Hi, I'm here to talk to you today about ulnar nerve transposition surgery. About a year ago I had surgery on my elbow, the medial epicondylitis. That's the inner tendon on your elbow, that pointy bone there. And that surgery went well, but over like the last year, during my rehab and just everyday activity, work, whatever, I noticed I was still having some pain. But it was a different type of pain. Like it was more of like a sharp pain. And so under the recommendation of the orthopedic surgeon, he told me to go see a hand specialist. So I did some research and I found one. I went to see this specialist. And the first thing he noticed was when he was examining me, he noticed that my ulnar nerve, it didn't sit in that channel like it should. He could actually move the nerve around. Now, whether that was because of the surgery on my tendon, you know what I mean? He had to actually cut the bone and stuff when he did that surgery. Who knows? But he said that ulnar nerve transposition surgery could possibly help because he feels the pain that I'm having is from that nerve moving around, and like going over top of the bone and stuff like that. So I figured I might as well do it, and because he said it could possibly solve my problem. So I went and had the surgery, and he moved the tendon. He cut the tendon that I had surgery on last year. He didn't cut off the bone. He just split the tendon, scrape the bone underneath it, possibly to get out any scar tissue, and he said that would promote bleeding. And then he sewed the tendon back together, and then he moved the ulnar nerve from that channel that it sits in to the front of my arm. And then what he does, I guess, he sews it into the meat of the arm, for lack of a better term, and then so it sits in there, and it's not being going over top of the bone. It has more freedom of movement, less tension. So it actually feels prethi good. Now I'm in a splint, okay, in my arm at that 90 degree, and that is mainly so that the arm doesn't move because there's an 8-inch gash in my elbow, okay. So he doesn't want the arm moving so that those stitches can heal the skin properly. So I couldn't do any heavy lifting. I can't do any heavy lifting yet. But I have movement in my fingers. I can do stuff like this, But all I did was light stuff. I didn't, do any lifting, just like he told me. So I'm going to go back and see him tomorrow, and he's going to take out the stitches, and I believe I will no longer be in the splint. And then I'm going to talk to him about rehab, and then go from there. So I'll give you guys an update on how things are going, and then thanks for watching, and we'll catch you later.